Good morning. My apologies for being a little late. I got held up. Um, but I see a lot of folks are already here. Let's give folks 30 more seconds before we start introductions. Welcome folks who are joining. We're just giving folks a few more seconds to get on. Oops. Okay, let's go ahead and get started. My apologies. I also have and just got a new computer, and some of the things on Zoom are like slightly different from how they were on my old computer, which I don't understand because it's still Zoom. So my apologies if I'm a little confused. Um, and I also realized that my member list where I thought it was not in the same place on this computer. So I found it though. My apologies again for that. My name is Kathy Kilroy Del Rio. I use she, her pronouns. I'm the advocacy and programs director at Maine Equal Justice, but I also chair the MAC. I also just wanted to make a note at the top of this meeting. I'm going to say it again later in this meeting that since Mallory Shaughnessy retired, we don't currently have a vice chair of the MAC. So if you are a MAC member, an official MAC member, and have an interest in being vice chair, reach out and let me know, and I can let you know more about the role. It's mostly helping me if I need someone to fill in for facilitation, sometimes to bounce ideas off of in terms of agenda. And there could be some additional roles too if somebody wanted that, but it's not a big lift if somebody is interested. So we'll go ahead and get started with our meeting. I see a few names that I'm not familiar with, so I'll just share that normally we start off with introductions and we go through the main MAC meeting member list, ask people to introduce themselves with their names, their pronouns, and either the organization or what brings them here today. Then we have folks from the Office of MaineCare Services introduce themselves. And then we have folks who are guests can either introduce themselves at that point or they can put their information in the chat. And I do try to keep my eyes open if a MAC member joins a little late, but if I don't, feel free to let me know if you need to introduce yourself. I guess if you're not here right now, you wouldn't hear me say that, so I'll say it again later. Okay, so sorry, I don't know why I'm so mixed up today. Let's go ahead and get started. Miriam Bashir. Enos El Harbi. Norma Desjardins.
Hi, Norma Desjardins, general dentist, St. Apollonia Dental Clinic in Presque Isle.
Catherine Brandt. Jessica Drenning. Ian Yaffe, do you want to introduce yourself at this point?
Sure. Jess is on vacation today, and I'm Ian Yaffe, director at OFI.
Jamie Bork. Or Eric Fromberg. Nilsa Ayanli. And I just realized that my list does not have the updated name for the Alliance for Addiction and Mental Health Services. Do you want to introduce yourself?
Yeah, Adam Bloom Picopoulos, Executive Director for the Alliance.
Thanks. I'll make sure that gets updated. Kathy Dion.
Kathy Diang, and I'm the executive director for the Autism Society of Maine. My pronouns are she, her, and I have a son who's a consoler.
Becca Matistovich. Or Kaylee Hess.
Hi, I'm covering for Becca today. Kaylee has she, her pronouns, Children's Oral Health Network of Maine.
Vicky McCarty.
Hi, I'm Vicky McCarty, and I'm a policy analyst for the Consumer Counsel System of Maine.
Rachel Collmore.
Good morning, everybody. Rachel Collmore, Consumers for Affordable Healthcare. And don't worry, Kathy, you're not the only one who's having a second Monday. So maybe it's the weather or the kids being home on vacation, but you're not alone.
Thank you for that. I believe we don't have anyone from Disability Rights Maine today. So I'm going to skip them, but if I'm wrong, you could put your, just tag me in the chat. And Gia Drew's not here today, but Izzy is.
Hi everyone, Izzy Ostrowski, she, her pronouns at Equality Maine.
Susan White.
Susan White with Home Care and Hospice Alliance, she, her pronouns.
Catherine Hamilton. Leo Delicata.
Good morning, Leo Delicata, he, him, Legal Services for Maine Elders.
Sarah Lewis. Laura Cordes.
Hi, good morning, Laura Cordes. I'm the Executive Director with the Maine Association for Community Service Providers, MAXB, and I use she, her pronouns.
Rachel Dyer. David Winslow. Ann Sedlak. Bobby Martin.
Good morning, Bobby Martin, he, him, Maine Primary Care Association.
Candy Henderly. Teresa Cochran.
Good morning, Teresa Cochran, Senior Director for the Center for Healing and Recovery for Wabanaki Public Health and Wellness, she, her pronouns. Good morning.
Good morning. And now I'll pass it over to the Office of Maine Care Services, and I see Michelle, so I'll let you kick things off.
Thanks, Kathy. Good morning, everyone. My name is Michelle Probert. I'm the director for Maine Care. I use she, her pronouns. Nice to see everyone this morning. And I will hand it off within Maine Care to Courtney.
There we go. Sorry. Good morning, everyone. Courtney Pladson, she, her pronouns. I'm the Maine Care Medical Director, and I will turn it over to Shannon McGrath.
Hi, everybody. Shannon McGrath. I use she, her pronouns, and I am a communications coordinator for Maine Care, and I'll hand it to Kayla.
Hi, everyone. Kayla Sargent. I use she, her pronouns, and I am the Associate Director of Strategic Planning and Communications at the Office of Maine Care, and I will hand it over to Amanda Lee.
Kayla. Amanda Lee, Rate Setting Coordinator for the department. I use she, her pronouns, and I will pass it to Sarah Fisher.
Good morning, everyone. Sarah Fisher. I use she, her pronouns. I'm the Maine Care Outreach Specialist for OMS, and I will pass it to Becky.
Hi, Becky Parsons. I'm the EPSCD Program Coordinator with the Policy Unit with OMS, and I will hand it to Lisa Weaver.
Good morning, everyone. Lisa Weaver with the Office of Maine Care Services, she, her, and I will pass it to Kristen Merrill.
Good morning, everyone. Kristen Merrill, State Plan Policy Development Manager for the Office of Maine Care Services. I use she, her pronouns, and I'll pass it to Jessica.
Good morning, Jessica Miller, Director of Policy for Maine Care, and I use she, her pronouns. And who else is on here?
I think that's everybody from OMS.
Great, thank you. Just checking in again, are there any official Maine Care Advisory Committee members who missed their introduction Okay, I see a lot of guests have put their intros in the chat. You're also welcome at this moment if you want to take yourself off mute. And I know there's a couple people on their phones too, so feel free. Okay, so then let's go ahead and jump into our agenda. And our first item, I'll pass it back over to Kayla for the access rule information.
Thanks, Kathy. So I am going to go over the impacts of the access rule again. Sanaa Osman had presented a high-level overview back in May. And what I'm going to share today is a document that we put together that outlines all of the changes that will impact the MAC and our planning for our Beneficiary Advisory Council. In high level, to kind of kick off Kathy's next agenda item with strategy planning and any action that the MAC may need to begin taking to help ensure we're meeting these changes. I'll share my screen so I can show the document with you. I'm not going to read directly from the document, but I am also going to make this document available on the website. So it will be both attached to, oh, I think I'm sharing the wrong screen. Attached to the notes from today. And then also we're going to find a place to keep it on the advisory group webpage where we can continue to update it with progress. So showing as we make changes. See if I can do this correctly. All right. Are you seeing the one pager or are you seeing my Zoom screen?
We're seeing
See
like
the
a
one pager.
Okay.
cover.
Perfect. Okay, perfect. Thank you. For whatever reason, get used to Teams and then switch to Zoom and I don't know what I'm doing. Okay, so this is something we're putting together just to guide us along. The major overview is that in addition to having a MAC, we now need to put together a Beneficiary Advisory Council. Some of the overarching changes that are going to affect the MAC are that we're going to be required to post bylaws that go over the standard processes and administration of the MAC and the BAC on the website for public review and availability. We are going to have to develop and publish our strategy for member selection and share that right on the website along with the member lists. We do already share the MAC member list. So the big change with that is that we'll also have a BAC member list, and BAC members will have the opportunity to be anonymous and be listed as BAC member rather than sharing their name publicly. We will be hosting regular Beneficiary Advisory Council meetings. We will need to have state staff in attendance at those meetings. At least one executive staff member needs to be at both MAC and the BAC. We'll need to be providing the technical support. That's all pretty standard. So the big change there is just that we're also going to be doing it for the BAC. And then the other big things are membership. There have been some new specificity added to the MAC membership requirements. So we'll want to take a look at that in regard to the MAC membership and just make sure we're still in alignment. They also made some distinctions that members of the BAC can also be caregivers or family members of beneficiaries. So that's good to know. There's going to be some standards for representation within the MAC from members of the BAC. They set forth that we will eventually need to meet 25% of MAC membership being BAC members. We have some time to do that. So by July of next year, we'll need to have at least 10% of MAC membership also being BAC members. And then the following year, 20%. And then after the third year of development, we'll need to maintain 25% of MAC membership as being those BAC representatives. The meeting frequency requirements changed. So both the MAC and the BAC each need to meet at least once a quarter. So 4 meetings a year. They did include a stipulation that the BAC meeting needs to happen before the MAC meeting each quarter so that there's some continuity of reporting out and communication between the BAC and the MAC. The other addition that's pretty big is that the MAC needs to host at least 2 public meetings a year, allowing for public comment and response. For participation and scope, they made it very clear that in addition to having an opportunity to provide input on policy and administration of MaineCare, we need to be using both of these groups to advise the state on policy and administration of the program. And then there's a new required reporting. The MAC will need to create an annual report each year. The MAC will be drafting the report and then including recommendations in that report, and the state then needs to respond to those recommendations before posting the report. The first report will be due by July 9th, 2026, and then we will have 30 days to post it on the website after that, and we'll need to continue with that trend every year thereafter. In the general compliance timeframe, we really have this year to put together the BAC and figure out our new schedule for the MAC and develop all of those other supporting materials that they outline, the bylaws, the recruiting strategy, and get those online. So we have until July 9th, 2025 to get all of that in place. And then we'll be focused on phasing in our BAC members to MAC membership and meeting those requirements in the years following. And then also the report will have 2 years to get that up. So that's the gist. In this document, I also outlined, I have a link to the rule, a link to the fact sheet, and then I outlined the changes in the MAC membership requirements, thinking this can be a place where we start to add some of those details as are helpful. And then, like I said, also add in progress updates and status reports so that we have kind of a running way to keep track of this in this meeting and then also available publicly online. I want to pause, just see if anyone has any questions before we dive into Kathy's next agenda item, which is going to be kind of kicking off some of these strategy discussions that will need to happen with this group regarding these changes. I actually also want to share one quick announcement. So hopefully you hear it here first. We're working on our public announcement. Oh, yep. And Michelle also is on the same wavelength with me. We were accepted into a learning collaborative. We were selected as one of 7 states chosen to work with the Center for Healthcare Strategies to help with implementation of our BAC. So that's very exciting. There's still a lot of work to be done to understand really the full scope of this project, but it is a wealth of opportunity. So we're really looking forward to that work. I'm going to drop a link in the chat that just kind of outlines that announcement. And the department will also be working on a public announcement as well. And
similar for Kayla a little bit more to say that this is a very competitive opportunity. There were many states that applied, so we are super excited to be able to be selected and to be able to take advantage. The Center for Healthcare Strategies is a really excellent national organization. We have participated in many of their efforts in the past and think it will be super helpful.
Thanks, Michelle. Yeah, we're really excited. And Sanaa Osman can't be here with us today, but I'm very excited for her as well. She'll be leading that project. And we'll continue to keep this group in the loop, similar to how we'll be updating progress on the Access Rule implementation plan. We'll continue with updates as we understand more about that project. Laura?
Good morning. Congratulations on being part of the cohort. And thank you so much for outlining. I mean, the Access Rule is so enormous, and I think this piece gets lost when it's talked about publicly, but clearly has goes in the direction I think the MAC has been moving to engage more of the folks who are using the system and making it more beneficial. I had a question about some of the timing and just thinking about reconstituting the MAC, I guess is the best way to say it, and how that might look through the year and the timeline for the department and MAC members to know, okay, so we're starting in on this process. What does it look like over the next 12 months? Do you imagine having everybody kind of in place, you know, at the start of the next fiscal year, or are you looking to make changes before then?
I think that question goes wonderfully into Kathy's next agenda item. I will say, just from like a high level look at the back, we're hoping to have our back put together, or at least kicking off by January, and to spend some time in those meetings with the back, educating folks, getting them up to speed on MaineCare, how it works, so that then they could begin to integrate with the MAC around that due date of next July. Things could definitely change with that piece of the timeline, just even with the Learning Collaborative, as we learn and understand how to best do that work. But if I had to predict, that's how I would see it looking right now.
Thanks.
Any other questions for Kayla? All right, thank you, Kayla, and congratulations to the department on getting that opportunity to work with other states on that implementation. So as Kayla mentioned, this is related to the strategic planning conversation, which I know has been long desired and delayed with legislative session and other challenges. So I met with Kayla last week to try to think a little bit about how these intersect. And because one question that I had was, you know, if we're trying to bring together this beneficiary advisory committee, then like we don't want to get too far ahead of the strategic planning and then not have the input from the actual people who are members. And so I think what we want to do is kind of a staged approach, similar to what Kayla has talked about in terms of implementing the rule changes. And the initial thinking is to have a small group come together over the next couple months to try to think about, like, what are all the things that we need to have in place and by which dates? Which are the things that we can begin to tackle now? Which are the things that we can tackle but we'll still need input from the back? And then which are the things that we should wait until we have the back to try to figure out? And then also just have that group also help with some creating opportunities for some bigger picture thinking, which I know is something that's been desired by some members of this group, in terms of thinking about, like, what are the key values that, like, we want to hold as we're making policy suggestions to MaineCare, for example. And again, those are the kinds of things that we also are going to want to make sure we have input from the back on, but we can start the process and then, but want to do that in a way that doesn't make it feel like the back can't make significant changes. So what we really need is a group of people who want to come together with me to try to help think through, like, what does that look like? So we do it in the way that we want to do it. And ideally, we'd like to have people who are actual MAC members, but also I know some of you are members of subcommittees and participate often in these meetings, and your thinking is welcome as well. So if you're not a MAC member, but feel like you have something to offer to that process and you're interested, you, like our other subcommittees that are open to others, please feel free to suggest yourself. And in terms of time commitment for this group, I was thinking that it would be great if we could meet once, either towards the end of August or beginning of September. I know August can be a tricky time in Maine. And then try to meet again a couple more times in the fall. So I don't think it would be a huge time commitment, but it would be several hours of time commitment. And then we can regroup at that point and decide, like, how does this connect with the back, which will be along its way, and how do we want to bring that information back to the bigger group for feedback as well. And then I also just want to name out loud that we've had some conversations about like other things that we'd like to discuss as a group that aren't necessarily strategic planning, but are like places where the MAC would either like more information so that they, in their roles outside of the MAC, can be more engaged in policy discussions, for example, or so that at some point maybe the MAC makes some recommendations to the department about certain types of policy issues. And so another piece that we talked about is I was thinking back to when we first reconstituted the MAC under the new administration, which is no longer a new administration, but back in 2019 and at the beginning of 2020, before the pandemic, threw everything off track. We often had presentations about things to help members of the MAC better understand what was going on. So for example, we had several I know that were around rates, and that was before the rate redetermination process had really begun, and trying to understand like, what is value-based purchasing, or what are alternative payment models and things like that, so that people, not that the MAC made a decision about those things, but that the people who were engaged in the MAC could then bring that knowledge back to their organizations or into policy discussions that were happening at the legislature. And that's just an example. We had others as well. And then the pandemic happened and we didn't have time for those kinds of things. And then since then, we've had some different reconfigurations that we've been trying to move through. So I was thinking that it would also be helpful to come back to this idea of like, how do we create space so that the people in the MAC fully understand things in a way that they can actually provide guidance or provide feedback that's meaningful. And it's not just a couple people know this issue really well and a couple people know this issue really well. And one place, for example, that we've had that conversation before is, around managed care, that keeps coming up. And we had said, let's have a bigger conversation about that. So that could be an example of the kind of thing that we might want to look at more closely. So I was also hoping that this subgroup could help think about how do we make decisions about what that looks like, and how do we sort of shift our agendas to make more space for that. So that's a lot, I know. But if any of those pieces sound like they are of interest to you, I don't know that everyone in the subgroup has to work on all the things, but first it would be great to have a subgroup come together. So if you are interested, I think the easiest way to do this would be to send me a message in the chat or send me an email. I'll put my information in the chat, although I think all of you have it. And then I'll send out a message to try to pull people together. When that first message goes out, I'll also send it to the whole MAC, because I know there's some people who are missing today who might be interested. So this isn't your only chance to do it, but it would be helpful to have a sense of some of the people who might be interested now. And I would love if we could have a combination of folks who have sort of a member perspective, MaineCare member perspective, and a provider perspective, because I think that's what makes the MAC such a great space, is that we have both of those perspectives here together. So that was a lot. Anybody have any questions? Okay, great. So feel free, send me a chat, send me an email. I'll put my email in the chat in a minute, or respond when I send out the message to the full MAC. And appreciate your help with this. And I'm going to just do a quick check-in to see if there's any MAC members who are on, but who didn't get a chance to introduce themselves. And
yes,
I just
Kathy, it's Sarah.
I was just going to say, I think Sarah's on the phone.
Yes, it's Sarah Lewis with Maine Access Immigrant Network. And I'm sorry, my internet would not load the Zoom, so I called in.
Yeah, no worries. Anyone else?
I think I'm a MAC member now. I'm not sure. I'm here as a representative of the Home Care Alliance, and Laurie Burgoyne from Home Hope and Healing. And so I think I'm a member at this point, but.
Well, welcome, Lori. And so for folks who don't know, Lori is here because Lori Belden is no longer here. And just so you know, Lori was alternate with Susan. So you are an alternate member.
Okay. Thank you.
Welcome. Anyone else? Okay. So then let's go ahead and jump into updates from MaineCare. And I'll pass it back to Michelle.
Great, thanks, Kathy. Let me just pull up my notes. All right. So the one exciting thing about this week is that this is when the initiatives and legislation from last session finally go into effect on the 9th. And so that means we're going to start moving on things that we've had to hold on because we did not have official authority or appropriations yet. Included in that list are the COLAs that we needed additional funding in order to implement that will be effective to last January 1, 2024. And those COLAs apply to Section 2, adult family care homes, Section 13, targeted case management, 17, community integration, 26, day health, 28, rehabilitation for kids, and 65, behavioral health, as well as Section 92, behavioral health homes. We sent out an e-message yesterday regarding guidance for those COLAs. I will just flag that that we're having some additional conversation internally to make sure that everybody's on the same page with that guidance. So if you have questions related to the guidance, please do reach out as indicated in the e-messages so we can make sure that we're addressing everybody's questions and meeting your needs in terms of how providers can adjust claims to receive that additional funding. Let's see, a couple other items that were discussed at the last rate setting subcommittee, which I attended and was asked to flag here. I'll just note that there were, costs have been increasing for critical access hospitals. In addition, Franklin Hospital transitioned from an acute care hospital to a critical access hospital, which has increased reimbursement associated with that change. And so we did have a budget initiative to ask for funding to increase our prospective interim payments, which track with increased cost to the hospitals, as well as the increased cost of that transition for Franklin Hospital. So that is another budget initiative from last session. More broadly, I just wanted to share with folks, if you have not heard otherwise, while there has been good news, there was good news at end of session and more recently regarding additional short-term kind of one-time revenue for the state. The projections for longer-term revenue beyond this fiscal year are not positive. We will know more when there are more fulsome revenue projections, which are anticipated in November. But in the meantime, I will just share that we're having difficult conversations and that a part of those conversations is also to what extent we will be able to proceed with the same pace that we have been undertaking around our rate reform initiatives. And so I just wanted to make sure that this group is generally aware of those dynamics, and this will be an evolving situation where we'll get more information and we'll keep you all apprised. Let's see. Okay, so those are my budget items. I can pause there for any questions.
I don't have a question, Michelle, but I feel like I would be remiss if I didn't say to folks who are hearing the budget concerns for the first time, maybe in some cases, that while I know you at the department can't say this, I will say this, that there are ways that we can think about revenue that are different than we've thought about them for the past 6 years and for the past 8 years before that. And there are options that we can take in terms of advocacy to try to increase revenue so that we aren't actually having to make tough decisions about things that need funding and can actually fund things adequately in the ways that we need to. And so if you're someone who maybe isn't as engaged in those conversations at the legislature, but are interested in being so because you know that you're going to be impacted if we have challenging revenue times, like, please feel free to reach out to me. At least I'm happy to connect you with others who are working on that type of legislation. And like, I just think it's important for us to remember that the revenue forecast isn't the only way that we can make decisions about revenue. So that's an aside.
Thanks, Kathy. Okay, the other update I wanted to share, so some of you may still remember that one of the exciting things from the past year is that our entire pharmacy system, along with other pharmacy systems across the country and other payment systems associated with Change Healthcare, went down this late winter into the spring. One of the lingering effects from that cyber attack against Change Healthcare, which reports up to Optum and United, is that we suspended our prior authorizations in large part to make sure that we could ensure that members continued to have access to their needed medications, and also, frankly, because of system constraints, while we were able to stand up our full system. I'm so fuzzy with timelines. I think it was in March. It was not and still has not been our full pharmacy system that our pharmacies work with MaineCare. So it's had limited functionality. We starting yesterday have restored our prior authorization process for pharmacy prescriptions. So that means that starting yesterday, medications that were started during the cyber attack and the outage that were not on our preferred drug list are now going to begin to reject at the pharmacy counter. So we have been communicating with members, we've been communicating with pharmacies. We recognize that it is often not a simple matter of just changing from one kind of medication to another from one day to the next. And so those factors are being taken into consideration with the transition. We have also shared a notice with a number of associations. I'm actually just seeing this bullet, and I don't actually see the Alliance on this list, so I will ask our pharmacy team to share that notice with the Alliance as well. Our pharmacy help desk, as always, is a really excellent resource for members who may have questions or concerns or are experiencing any difficulties. They are really skilled at working with members as well as pharmacies that are involved to make sure that things go as smoothly as possible. And just a reminder, because this topic comes up periodically, so within the Medicaid space, not just MaineCare, prior authorizations on the pharmacy side are often, because we need to cover, for the most part, all drugs, and the prior authorization piece relates to our rebates, because we, unlike commercial payers, do not have a lot of flexibility in the drugs we choose to cover and choose not to cover. We officially prefer the drugs where we are able to receive rebates to help mitigate very high costs that we see as a country around pharmacy. So many of the preferred drug list relates to our ability to get those rebates, which are critical to the finances of the Maine Care program and our ability to keep at our current levels of coverage. Let's see, our pharmacy director, Emery Todorico, is at a conference this week, but she just sent me a chat. So I'm going to breeze through that to see if there's anything else that I should share. We are having pharmacy office hours scheduled for Friday this week. In case issues are coming up for those pharmacies. Our provider help desk has seen a slight uptick in calls from other states that have gone live again with their PAs. They really saw substantial increases in volume from members on like the 3rd or 4th day. All right, Courtney.
I just wanted to provide 2 specific kind of follow-up pieces to what Michelle shared. So I was in clinic yesterday. Absolutely, this is going to be a challenge. We're going to have a number of PAs for patients on medications, as she said, that have been started. So the pharmacy that I work with often, I called yesterday and asked them to see if they could work on a report on specific medications. So I do a lot of substance use treatment work. So I asked them to if they could pull a report on all the patients that have been started on Sublocade, for example, things that we know require prior authorization. So we're trying to encourage offices to be proactive, to work with your pharmacy partners, so we can really try to prevent any delays of care. And so we're hoping that these partnerships will really help to make sure that patients have their medications on time. The other thing I wanted to say is that, you know, one of the things I get emailed about the most often related to pharmacy benefit is about medications for weight loss, things like Wegovy. And I just wanted to share for the MAC to know that there is a CMS regulation that we cannot pay for medications like Wegovy unless someone has a specific medical condition like heart disease for weight loss. And so I just wanted to share that there are a few patients that, because we didn't have prior authorizations, that were started on certain medications, that we're not going to be able to continue to pay for moving forward. And the team has been really amazing. Have sent letters to individuals to let them know ahead of time that this could be coming. So I just wanted to share that way everyone has all the same information. If people have specific questions they want to follow up with me on, I'm going to put my email in the chat. But I just wanted to provide, if your members or folks that you're supporting are having pharmacy issues, absolutely, the help desk is amazing. That team works so hard, and encourage them to work with the providers, the prescribing providers, to work with their pharmacy partners to see how we can proactively prevent some of these bumps in the road. But if anyone is having particular challenges, don't hesitate to reach out.
Thank you both. Michelle, is there anything else from Maine Care?
Happy belated birthday to Medicaid last week. I think that's it.
Nice. I will spare you all. We won't have to sing happy birthday. Thank you for all of that. Also, I know some of us who work more closely with members will make sure our teams have the pharmacy desk number in case we get inquiries. But if there is any more public message that would be helpful for us to share with our networks, just let us know. I know Kayla had to jump off early, but let us know. Okay, let's move over to OFI. Ian?
Great. Well, good morning. Thanks for having me today. As usual, I can start with a bit of an unwinding update. I think as folks in this group are hopefully pretty familiar with now, we are now at the tail end of the unwinding period with all of the pending and overdue renewals that hadn't been completed yet as of today will need to be completed between the end of this month and October. And so for folks that have been doing outreach about this or that have questions, now is definitely the time period to pay attention to that. Not that the previous time period was a time period not to pay attention to, but now is especially important because we have begun to resume procedural terminations for members that don't complete their renewal. So there's two sort of overarching pieces of advice here that still apply to all main care members. And I just want to acknowledge that there's obviously two very different populations of main care members right now. There's the I can't remember somewhere around like 325,000 main care members who have already successfully renewed their main care coverage during the unwinding period and now will need to renew it again and continue renewing it in the future. So for those folks, the same, that's one population. And then there's a second population of approximately 52,000 main care members who did not renew their main care coverage through July and will need to do so between now and October. And so either way, for both groups of people, the advice is the same. If we don't have your current contact information, anytime that your contact information changes, please let us know by going to mymainconnection.gov, or you can give us a call and you can change your contact information using the voice response prompts without waiting to speak to an eligibility specialist. A couple of minutes ago when I checked, we currently had 0 people on hold for the main care line. So we're also able to answer those calls really quickly for people that have experience waiting on hold. So one thing is to update contact information, and the second is to please pay attention to the notices that we send you. We are still sending renewal notices in the mail with the blue block envelope. So if you get a blue block envelope, if it's blue, it's time to renew, and pay particular attention to that. But I think as we approach the end of the unwinding period, the advice is really to pay attention to these things all of the time, because they aren't special requirements. They aren't special requirements that have to do with unwinding. Unwinding is the undoing of something special where you didn't have to do that because of the COVID-19 pandemic. So that's the overall update. A couple of more granular things to let you know about. One is that we will have a blog post out later this week, along with an update to our dashboard showing the unwinding renewals through the end of July. So by the end of the week, that'll be up on our website. And we will also have a memo that will be included in that blog post around some of the populations that are included in the pending renewals in terms of different demographic groups or things where you might want to target outreach a little bit more narrowly. I still think almost every demographic group has folks that are in the pending population, but we do have the more granular information that'll be released at the same time with a blog post later this week. And that will include, that analysis includes going through the changes to the pending population that occurred in July when we implemented the individual level automatic renewals. So it's very, very current data based on who is still pending as of this week, which will be less than 52,000 people when we release the information, because some of those 52,000 have successfully renewed with the successful deployment of the automatic renewal process at the individual level. So we'll make sure that you get a copy of that this week when it goes out. And then I suspect when we have the next MAC meeting, be able to have a pretty significant update around what the end of August looked like for renewals that were due at the end of August. And we do have a slightly larger percentage of people who would do in August as opposed to September and October, with the goal of making sure that we process all of those decisions as quickly as possible and don't have, we're in as best of a position as possible for the open enrollment period that will begin in November. And then I think somebody's asking this question in the chat, and the last important thing that I'd say for people who receive a closure notice for the first time in particular, and that's the I should do something alarm bell. Hopefully we don't get there, but if you do, there is a 90-day reconsideration period where you can call us and we'll still process your renewal, and we will renew your main care with no gap in coverage during that 90-day period. So I'm going to stop talking and see about what the questions are in the chat real quick. And so I think I covered perhaps the question about if somebody gets a closure notice, they can reopen without going through the fair hearing process. You just give us a call, and if you just didn't respond to renewal within 90 days, we can reopen it during that 90-day reconsideration period. That's different than the fair hearing process or filing an appeal. If you disagree with an eligibility decision, there's a process to do that, which has different timelines. But that's appealing the decision is different than simply requesting us to process a late renewal, which is what the 90-day reconsideration period, and we can process late renewals up to 90 days after they were due with no gap in coverage. And then if it gets after that 90-day point, that would just be considered a new application, and there would be a resulting gap in coverage. But for most people that we've seen, I think we do see a lot of we call them reopenings, or we do see a lot of those happen in the sort of 30 days after closure, when somebody either realizes that main care has been closed or finds out because they went to a pharmacy or a doctor's office, and then we can reopen coverage, usually very quickly in those cases if there's a piece of information that is needed to be verified. The good news once we get through the unwinding period is that the individual level automatic renewals are here to stay. And we have seen really high renewal rates when we looked at July's population, which had very few pending members in it, if any. Because we weren't rescheduling into July, we saw a really high individual level passive renewal process rate. That will probably be the highest it will ever be for a while, but for a lot of main care members going forward, we expect to be able to passively renew coverage at the individual level, regardless of if you have other benefits that require sort of manual renewal processes. For main care, we're able to make that renewal automatic for, I think, the majority of members going forward. Is a pretty safe assumption, at least for the near future, of what to expect with passive renewal. So we hope to see a lot of great improvements here with reducing churn among the main care member population.
That's terrific, Ian. I'm so glad to hear that. I did just want to add one thing for Jillian's questions about if someone loses coverage or uncertain what to do. Everything Ian said was right, of course, but also if they need help if they're someone who just isn't sure like what happened or they don't know how to navigate the process. There are organizations that can help, and Consumers for Affordable Healthcare here is one of them. Rachel's raising her hand, and also Maine Equal Justice is another, and there are others as well, depending on that person's background. Like they might get help from other organizations as well. So there is help if someone does need help navigating the process.
Yeah, if I can jump in real quick, those notices of decision can be confusing sometimes, especially if they have multiple dates on them. So if anyone is ever working with someone and they have questions, or give us a call and we'll help them figure that out, or help them figure it out. So.
And I'll, Kathy, this is Sarah Lewis with Maine Access Immigrant Network. We also are doing a lot of work helping folks when they get those, if it's blue, then renew, blue block holders who speak languages other than English. And Ian helped us set up a direct helpline to his team on Fridays. So if we do have, a complex case, which honestly most of them are, just like a little bit harder than usual, we'll give them a call, or at least we know that we have that access. So just throwing that out there.
Thank you both. Kathy, I see your question. I'm guessing that's why you had your hand raised. Ian, do you have a goal of the percent of people to be passively renewed?
I don't think we have a goal percentage. It's probably too early. I don't think that we'd really be able to look at what an average percentage is yet here either until we get through the unwinding renewals, because each of the populations that will be renewed in August, like August as a whole, looks really different because you have so many pending renewals scheduled in that month. And the same is true for September and October. Once we get into November, December, and January, I think we'd be able to look at what those individual passive level renewals look like and then start to think about what that means for an average. But from a goal percentage, I think our goal is that as many people as possible. We know that it won't be 100%, but we are, our goal is that it's as high of a number as possible, because it means that people don't lose their coverage, means that they don't have to do anything, and it means that we don't have to do anything. So it's a pretty great outcome for everybody who, when we already can verify their income. Again, that's not true for other federal programs, particularly SNAP, where we still need to do the manual renewal for everybody. So for some households, they will they'll automatically renew for MaineCare, but they'll still need to do something for SNAP, and the something that they have to do is the same thing that they would have had to do for MaineCare in the past. But from a health coverage perspective, it means if they don't do that thing for SNAP, they still keep MaineCare, and that's the biggest change from going from household to individual level renewals is for MaineCare only members that have maybe kids that automatically would renew. Those renewals go through automatically for the kids, even if the parent has to verify income or something like that. And then for members that have multiple benefits, previously, one benefit, if you had to do them all at once, and we still renew all of the benefits on the same date. But now if we have enough information to renew MaineCare and we don't have enough information to renew SNAP, then we still renew MaineCare automatically, and then let you know that you'll be getting a renewal package for SNAP, essentially. It might not be a big change in what type of information is needed to be provided, but again, it has a very big effect on reducing churn among the member population. And for members that don't require any casework processing, we can automate that and focus our staff efforts on the people who do require processing. And hopefully that results in better an improvement to customer service overall.
Thank you. Any other questions related to the unwinding?
Yes. Kathy, Ian, the 50 some odd thousand that still have not renewed and they need to renew, I think you said by October. Do we know where those 50, do we know any breakdown, and is there a targeted approach to reach out to them?
Yeah,
And,
so
and,
we,
and I'm asking for a friend, meaning asking for those who might be receiving, more mail in English, and it's like, yeah, whatever, like they don't know that they need that's actually important because they just haven't seen the messaging, even if the messaging's been in their language. Just thinking if there's a targeted approach some of us CDOs could help you with.
yeah, so that that population, which will it will be less than 52,000 when we release the data this week, because we have the passive level renewals completed for them already. But that's the population that we'll be releasing more information about this week, with an analysis of the different, I think, geographic areas that folks live in, race, ethnicity, categories, and also language, in order to get a better sense of what are the disaggregated percentages and total numbers for that population that still has to do something between August and October for their coverage to be renewed successfully.
And I'll just add on to Ian's statement to be clear that it's not just that they have until October, it's that for that population of about 50,000 minus those individuals who OFI has been able to passively renew, they will each have a date. So they will either be scheduled in, they'll have renewal dates for August, those notices go out in July, or September or October. So so it's not just until October, it's that population will be assigned a date, and we need to hear back from them in that time frame. Again, there's still the 90-day reconsideration, just as Ian said, but just to be clear on that.
Yeah, that's a good point. Thanks, Michelle.
Also, I want to thank Adam for his comment in the chat, and not to like detract from a nice positive statement, but I want to make sure that people are aware that in this period of this 3 months, we are going to be seeing higher disenrollments just by nature. And so we've been trying to be very clear about that. And really are looking for assistance and help from our advocates and providers, and trying to get the word out with members as well. So I did want to be clear on that front. We certainly, as a department, have really worked hard to minimize loss of coverage, and that is true. I think also we ended up benefiting more than other states. Many states have had ex parte passive renewal systems in place for a long time that did not look at the individual level. And so when CMS clarified its guidance after unwinding had already started for a number of months, we had not implemented yet. So when we really went fully live with ex parte, it was at the individual level. And so we didn't go through what many other states went through of having disenrolled individuals that they then had to reassess. So there was less churn given the process that we went through, just for some additional information there.
Yeah, and oh, go ahead, Kathy.
Well, I was just going to flag that you, Ian, shared more information in the chat, and for folks who are on the phone, I'll share out the links that have been shared in the chat following this meeting.
Yeah, thanks, Kathy. And we will, so I did put some links in the chat, just if you want to get a sense of the current population level breakdown. That's in the presentation that we did in June. But again, that information will be updated again this week. So if you're going to make any significant plans based on any of the data, I'd wait till this week, because it's going to be 2 months more current. And we've reduced the pending population already. But I really do appreciate Michelle's point. I think we've done we still are continuing to do as much as we can to reach members and let them know about these renewals. We will continue to send email and text reminders to people who haven't completed their renewals, but it is a monthly process for each person. It's not everybody for October. It's some people for August, some people for September, some people for October. And the particular way that that's distributed right now is more front loaded to August than it is September and October, with October being the month where we have more of the recent pending renewals, hoping that they might come back or reopen before we send out another renewal notice. So I think for people who are wondering, you know, like if somebody's getting something in the mail now is the time that they have to do something. And for many members, they should have received that sort of final renewal notice already. They were mailed towards the end of July, and they mostly should have been received by now. If you receive mail or if you have an e-notice, then it would be in the mymainconnection.gov portal. Either way, if people have no idea what I'm talking about and you're talking to people that are like, I don't know what my renewal date is, I don't know if I renewed, you're telling me this is like important for the first time in 4 years. Yes, that is true. It's always been important, but it's really especially important for people due the next 3 months, because it's the first time they've had a renewal that is due that will have consequences of not returning it. Again, with reopening as a possibility. But we do expect that a number of those folks, this isn't the first renewal notice that they've received. It could be the 4th or the 5th. And so we, on the flip side of this, we have a lot of notices out right now, and we haven't yet seen an uptick in returns. It is still very early to tell that. We're tracking that number daily to make sure that we have the right number of staff processing renewals versus answering phone calls and things like that. But we haven't yet seen a significant change in our renewal processing. And so hopefully with your help and with the outreach that we're doing towards the end of August, we'll see a lot of those August renewals start to come back. But I think the simple answers to this is a very complicated process that has been going on for a while now. And I still think the simple answers for anybody that you're talking to, if you're a current MaineCare member and you're like, what does unwinding mean for me? One, it means that we're going back to a regular renewal process for everybody. And so if you should always make sure that we have your current contact information so we can reach you. And if you're not sure about what your renewal status, you can always go on mymainconnection.gov and check it out and submit your renewal online if it's due. But I think that's the simple answer for folks, is that they do need to pay attention to those things. And if they have questions, I appreciate the folks on this call who shared that your resources, and we also have our staff that are available to answer questions that members may have, so that we can meet our shared goal of having as many people who are eligible for MaineCare continue to be covered through MaineCare during and after the unwinding process.
Thank you, Ian. The other OFI related agenda item was around MSP challenges. For those who don't know, MSP is the Medicare Savings Program. And this is actually an issue we talked about a couple months ago as well. Several folks who work on outreach and enrollment specifically around MSP had brought up some concerns a couple months ago, and then again in the last week or so. For just to level set for everybody, that program provides support for people who have Medicare in paying for the out-of-pocket Medicare costs. And so it's for people who are a little higher income than people with full MaineCare. And one of the differences between applying for MSP versus full main care is that your assets don't count. If you're 65 or older, if you have Medicare, the screening category that you're in for eligibility for main care is different than people who are younger or kids in other categories. And assets don't count for those other categories, but they do for people who are 65 or older or who are disabled and who have Medicare. So, but MSP, they don't count. So it's been a challenge that folks have shared that when people go to apply on My Main Connection, at this point, there doesn't seem to be a workaround yet for people to be able to skip entering their assets if they just want to apply for MSP. And then the secondary problem that folks have raised, because we talked about this a couple months ago, and one thing that we pointed out was that people could use the paper application and skip the asset part, but also some of the folks doing enrollment work have said, people don't realize that they can skip that part on the paper application, and wondered if there was a way to include some language that says, if you're only applying for MSP, you don't have to complete this section. I will just flag, like, as an organization that worked really hard to get an integrated application in place, that like one of the reasons for having the asset piece there is that somebody might think that they're only applying for MSP, but maybe they're actually eligible for full main care, or maybe they are eligible for SNAP and they don't realize it, for example, and then they would need to include their asset information. So I think any language that we include that says you can skip this, it's important to like be clear that then you won't be found eligible for these other options. But folks who have been doing this work were wondering, is there any update around whether the My Main Connection, like ability to skip the asset part, is happening? And B, would there be any ability to try to add some language around the paper application to make it clear that you could skip that if you're only applying for MSP, the asset piece? And also, I believe those folks are also working on some potential language that they could share, and they'd be happy to share that with the Office of Family Dependents as well. And Rachel, I see your hand, so I'll let you jump in.
Yeah, so I agree with everything Kathy has been saying about some confusion completing applications and the asset question being a barrier because people might think that I'm not eligible and not apply. But I also want to mention that we are even working through those, we're experiencing some issues where just because things are still a little wonky, like with the changes, where some applicants are erroneously being enrolled in DAO as well. So just want to keep it, like, let everybody here know that like that application thing is tricky, but some of the determinations are coming out a little bit sideways. And if anyone has any questions about those, I do know that Amanda mentioned at the community partners meeting, I think it was, no, Jessica, sorry, that they're working on that, right? That there's some, and it looks like Ian's maybe dropping something in the chat, but there are some issues happening with incorrect determinations. And I don't know if anyone wants to speak to that after we address the application thing, because it's really important and it's confusing members.
Yeah, so I think I should probably speak to both then. So for the asset information, I think the short answer is that we're definitely aware of the two issues described with My Main Connection and the paper application. I don't have an update on timelines yet for when we may be able to make updates to those, but I think it's safe to assume that that means it's not going to be next month. We will, I'll try and have a better update this next MAC meeting on just what our timeline is. I think there's sort of two related questions. One is, will we create logic in My Main Connection in order to skip assets for people who are only applying for MSP? And then same, an indicator on the paper application that you can skip this section if you have assets. So there's like the yes, no decision confirmation, which I can get back to you on next month. And then separately from that, if yes, what is the timeline to implement both of the changes? Which I still think will, I don't have a good sense of that, but again, those aren't quick. Changing the paper application doesn't take us that long, but we try to only do it once or twice a year in order to not have a bunch of applications that are now out of date. But that's changing a paper application is as complicated as changing a Word document. It has to go through lots of review, and it has to be printed and lots of other steps, but it's not a complicated project to add or change language on a paper application. Creating logic in My Main Connection to skip assets for a particular program is probably slightly more complicated. And so that's why there might be different timelines for that. Either way, can definitely reiterate that asset information has no bearing on current MSP eligibility decisions. So you can confidently tell people to skip providing assets on a paper application if they're very sure the only program that they're applying for is MSP, and then we will make an appropriate decision based on that. More complicated for My Main Connection, but I think the flip side to it is for people just be aware, a lot of people apply for sort of all programs that they may be eligible for. And so again, we do need asset information for some programs, even if you're not sure if you qualify, so that at the same time that we make eligibility decision for MSP, that we can make an eligibility decision for either full main care or SNAP or whatever other benefit that you may qualify for. So there's definitely pros and cons to either approach, but there is a reason to get as much information as possible at once so that we get a decision for all programs that somebody may be eligible for, not just the programs that they think that they may be eligible for. But either way, I'll have better updates on that in September. And then I can go to the next question, or I can pause if it's an asset question. Is that a go to next question or pause?
Oh, no, sorry. I related to like creating some kind of like logic, like if you check yes, if you check no. I really appreciate, genuinely I say this, that the My Main Connection application wants to screen people for as many programs that they may be eligible for as possible, right? Like, and we want people who are eligible for SNAP to be able to get SNAP. And I would like to see that, you know, checking, I don't want to, I'm only applying for MSP might deny someone the opportunity to apply. I would suggest that if nothing else, if where we come to the asset question, there is something there that says, hey, the asset test only applies to the following programs, right? So that people know that like, hey, you know, go ahead and answer this question, but if you're applying for MSP, it's not going to apply to you. That might be helpful, right? Just a suggestion, just to kind of clarify that. And maybe that would be easier than adding that logic step into it. I'm not sure.
I will pass that back to the team and have a better update. But I appreciate that feedback. I think it's helpful to hear. I mean, I think the challenge here is just knowing, you know, that we never want to, you know, not have somebody apply for a benefit that they didn't know about because they just didn't know that they qualify. But I get also that if somebody comes in and they're very clear, like I only want MSP, I don't want anything else, that we also want to make it easy for them. And so it's a prioritization question for us. And then also just what is the timeline to make those changes question. But I will have, I'll share that feedback with our team and then have a better answer at how we're going to approach this in September. And I'll see if we have, I don't know if there's anything we've learned so far. It's probably a little bit early of if we've learned anything about the folks that have been applying for MSP since the asset test was removed. But I'll see if there's any learnings that we can take away from there in terms of, you know, how many of those folks maybe came in and were applying only for MSP and ended up qualifying for another program. I think that's always the interesting question. We get that sometimes with marketplace redeterminations where we we get a marketplace referral that, the folks come in expecting that it's only going to be main care, and then it turns out through the process in connecting with an eligibility specialist that they also end up qualifying for SNAP. So it's always there are those stories of people who really did come in expecting only one benefit, had no idea they would qualify for another, and then automatically through integrated eligibility gain access to something else. So I will again have a better update in September for the issue that you pointed out with Dell, with some new MSP members enrolling through the QI program or qualifying individual. I believe that issue has been fixed, so it shouldn't be, it should not be occurring going forward, but I did hear of a couple of examples of people who were incorrectly being issued Dell benefit when they should have only been being issued a QI enrollment. If you continue to hear any issues of that happening as of today, if you could let me know if you have any more issues like that happening, it would be helpful to be aware of. And then I'm working on a current request with our team just to see if we can better understand how many people may have been impacted by that issue, and so that we can go through and make corrections and improve the wording of the notice of decision as well. So thanks for raising that to our attention, though.
And just so folks know, Dell is drugs for the elderly, and QI is a category within MSP that stands for qualified individual, I believe.
Yeah.
Any other questions around MSP? Rachel?
Sorry, I'm just like dominating the meeting today. I apologize. So this question is kind of related to MSP, but more broadly, like the non-Magi categories. So when we're helping people apply or enroll for programs, more and more we are finding households with members who are 65 and older who would be applying for non-Magi categories who have dependents within their household. It's our understanding that for non-Magi households, like the maximum household size is 2. Are there ever any exceptions to that rule? Just because, these households, they do have this added expense of, sometimes taking care of grandchildren and whatnot. And we're just curious if there's ever any exception, or if there's the potential to work on maybe making things a little easier for households who have dependents and added expenses related to taking care of dependents.
That is a great question for Jess, who isn't here today. So I can maybe I will take that question back to her and make sure we get an answer back next month for you.
Okay, I really appreciate that. And I also appreciate Kathy like translating in the background when I use all of these acronyms. So thank you, Kathy, for being my right-hand man today.
Yeah, so thanks for bringing those up. I mean, I would say, I know that I've been in this role, I'm coming up on the 1-year mark, and I just want to say I really appreciate these types of questions and outreach to our staff around, we make hundreds of thousands of eligibility decisions every year, and these programs are often very complicated for our staff to understand, and they're complicated for you to understand, and they're complicated for members to understand. And so I do appreciate you raising issues where we can be more clear, either with members, with you, ideally with members, with you, and with our staff, knowing that we have 3 very different constituencies of all of these requirements and a lot of things to sort through. So I just really appreciate these types of questions and being able to work through some of those challenging eligibility scenarios. We do have an associate director of communications position that was included in the governor's supplemental budget. And we will begin interviewing for that position next week. And so I'm also really excited for OFI to be able to have a resource that's really dedicated to communicating more clearly with you all, with members of the public, and with our staff, because I know sometimes it's just really hard to get a clear answer to what seems like a simple question. Sometimes that's because it's just not a simple question. Well, I'll follow up on the SNAP asset side of things too next month. But I think we will try to figure out more ways that we can communicate those things and put more, for example, the MSP frequently asked questions document, we worked with OMS, ODES, and the Bureau of Insurance to try to get a list of questions that might come up with this program so that there is one place to go for answers. And I hope that we can do more of that in the future, since you have lots of different related questions, that OFI might not be the only resource, but if it's a primarily eligibility related question, we hope to be able to do more FAQs and things like that to make it easier for folks to know how something's going to be processed before it actually gets processed. And then the last thing that I wanted to share, in case people aren't aware of, but I think there's a number of folks who are already co-hosting this, but there'll be a information session about MSP in particular on August 15th from 12 to 1. That's being hosted by the Maine Council on Aging, as well as many partner organizations here, including CAKE and I think Maine Equal Justice as well. So there'll be another opportunity for more detailed questions about MSP and the application. And as you're getting ready, if there's folks who are hosting that, if you're getting ready for that and you just want some clear answers to common questions that aren't in the FAQ, let me know and we can try and get you some bullets or the best possible information that you are trying to share at that webinar coming up next week.
Thanks, Ian. And one last question from Kathy, and then we'll move on.
I just wanted to share that I'm with Maine Health Access to Care, and one of our programs is medication assistance called Med Access. And we identified over 500 people who were currently enrolled in that program, who may be eligible for Medicare Savings Program. And so we did a huge mailing to that group. And we're starting to get people to respond and get applications in, which is all great. One issue that is coming up for people is that their medications, whether or not they'll be covered when they move to Medicare Savings Program. And while we do say that Medicare Savings Program will work with your current plan, I just wanted to point out, and maybe this is something for the FAQ, that you may have to reassess what your prescription coverage is, because depending on your medications, it does seem to sometimes come up that, oh, well, this plan doesn't cover that medication. So maybe there can be some further education to myself and for my team as well about how to guide consumers when they're moving to Medicare Savings Program to make sure that their medications will be covered.
That's a good question. Probably one of the ones that goes into a much more complicated and probably, unfortunately, more individual level analysis. But definitely appreciate the question.
I agree, and I would presume that it may get into the Medicare space a lot as well. So I'm curious if CAKE or others has encountered like best pathways for resources and figuring out the answers to those questions, because it's likely not within OFI and Maine Care.
Yeah,
Certainly introduction.
So Michelle, I think that that's a hard thing for cake as well. Like even when people are even when they're jumping into the Medicare savings program and what specifically is going to be covered and what's not. And I'll be honest, when it comes down to like, I guess what would be like a drug formulary for like MaineCare, like we really refer people to MaineCare Member Services and have them like ask those questions. And maybe that's not even the right place. As Michelle rolls her eyes like, oh gosh, you don't really do that, do you? But there are just some questions.
That wasn't meant to be an eye roll. That was like me thinking. Like I wasn't rolling my eyes at you, just to be clear.
Did she? But it is hard, right? And things are, and it's, things are always changing, like, one thing's covered now and it's not going to be covered later, or something wasn't covered and now it is. So, there really isn't an easy answer for that. But when people do switch over to MSP, like, we bring out all the bells and whistles, like the Part B premium is gone. So like, there may be other costs, but like, at least this is gone and this is how this works. And if you have any questions, call us back and we can help you, figure out what this is. And if we don't have the answers, maybe we can find the people who do. So, Kathy, I would say that, if you are finding that people are having some trouble and you're overwhelmed, you can always send them our way and we can answer the questions that we can answer, and then we can help them find the answers elsewhere. And I will also say that our call volume related to MSP has gone up significantly. The majority of our calls last month were related to MSP and applications and questions around it. So you guys are doing a great job getting the word out there, and people are really appreciating this expansion. So thank you so much. It really, and if you could hear the stories we're hearing, people are so grateful to be getting this coverage. Just bravo all around. And if we can be of help as people are making that transition, at 800-965-7476. And I dropped our MSP flyer in the chat too. So.
Thank you all. And I know we took longer on that than we were supposed to, but I think it'll work out time-wise in the end. But it felt like good things to touch base on as we both wrap up the unwinding and also continue to implement this new eligibility change for MSP. So next up is the provider subcommittee updates. And I know we don't have a chair for the provider subcommittee at this time. And so that's just a flag. Like, that subcommittee, we put it together in order to move some of the conversations that were really in the weeds about provider stuff that were happening often in this space into another space, so that it wasn't taking up so much of the agenda for the MAC. And also so people could really get more into the weeds than we had time for here. But we need someone to chair it if it's going to continue. So if you're from one of the provider groups and are interested in helping to make that committee continue, ideally, we'd love to have a chair and a vice chair for each subcommittee, so that in a situation like this where someone retires or leaves, that there's another person able to step in without having to start from scratch. But I'm just flagging that. If you are interested in being the chair, or think someone else might be interested who's not here today, please nudge them and let me know, and we'll try to make that happen as quickly as possible, because otherwise that group is kind of stuck for right now. But we did, I believe, Jessica Miller, that you were going to share a couple updates around e-signatures and the Accentra submission request status.
Yes, thanks, Kathy. Keep this pretty quick, and just want to get back to folks on a couple things that had come up through us. One had to do with the use of e-signatures and a requirement that wet signatures also be submitted. So just wanted to let people know that we will be sending out an e-message addressing this, and that ultimately we will be updating the rule. But in the meantime, we will permit the submission of electronic signatures without submission of a wet signature, provided that providers are using have adequate safeguards built into the system that they're using to collect those e-signatures, that HIPAA compliance, and that they're doing appropriate authentication. So that's just a heads up on that. And then the second one was the request to extend the PA submission window for behavioral health providers back to 30 days, which I think had been in effect during the PHE, to shorten that to 10 days. And the short answer on that is that we don't have a final decision on that. So we will follow up on that as soon as we do. And hope that's helpful.
Any questions for Jessica? And Jillian, I see your offer to temporarily chair the subcommittee. I think technically you have to be a MAC member in order to chair the subcommittee. And I know you used to be a MAC member, but aren't now. But I think if you wanted to convene the subcommittee and then maybe through that convening have a conversation about who could be chair, that would be helpful if you're willing to do that. And I don't actually have the contact information for people for the subcommittee, but I think you probably do because you were mostly on. I know you were one of the people who regularly attended. Thanks, Jillian. Thank you. Okay, so next up is rates. The rates subcommittee and updates. Amanda, Lee, are there any updates from your end beyond we put the link for the monthly update?
Just wanted to quickly call out that the kickoff notice went out yesterday for the nursing clinical home community-based services study. So that's going to be on August 28th between 10:30 and 12, and it does have a registration link. So I just wanted to call that out, that if people were interested, I'll put the notice in the chat, the link to the notice. And then if people want to register for the kickoff meeting, they can just link into that and then link to the registration. And then the only other thing I wanted to call out was the Section 92 notice for the COLA yesterday did have an error in the title. The implementation date said 1/1/24, but it should have been 12/21/23 due to their monthly billing cycle. So we're going to send a correction out today, and the body of the email does have the right implementation. It was just the title that we missed it. So that's really all I had, unless anyone has questions.
Mandy, I would just flag that this sort of as shorthand, we're calling this HCBS clinical rate determination. There is a broad set of services under this rate determination. It goes beyond HCBS waiver services. It extends into sections of policy that are more related to personal care, home health. It's really looking at, I guess I'll say that I would encourage folks to look at the notice because there are many sections of policy and services that are implicated.
Right, thank you.
Thank you. Laura, are there other updates from the subcommittee?
Just a few, thank you. It was nice to have both Amanda and Michelle in our last rate system subcommittee meeting. We tend to meet once a month and the last Monday of the month, but in July we met on the 22nd. I'll talk about that meeting in just a moment. We also had a joint provider and rate system subcommittee meeting with folks from the department to talk about alternative payment models and value-based models, and that was great. And we do have that video and then the slide deck, and I think that's going to be posted somewhere within MaineCare page or the MAC page, but I'll share that a little bit later as well. We do not have a meeting in August. We're taking August off, so our next meeting will be in September. I'll post that date. But, you know, I'll just go back to our meeting in July, and, you know, we were really fortunate to have the stars aligned to have Michelle in the meeting because we had tried to come, okay, after session, let's have a conversation to see, you know, a couple years into rate determination system, what does it look like? Are there individual bills? What comes out that impacts both rates and or the process? And, it was a good review of what was already in the budget as appropriated to help a lot of services, getting funds back in the Maine Care Stabilization Fund. So it was good to have that review. It was a sobering and deeply concerning moment. However, and I appreciate Director Probert highlighting it here for folks that, the concern from the state perspective about what the revenue forecasting looks like, and the financial support that's going to be there in the long run to support the system that the state and, all the stakeholders have been behind in creating a rate setting system, a really transparent one that's funded with COLAs, when you don't have, your rate determined in that 5-year cycle. And, to imagine that the funding may not be there for annual COLAs and or we're in the process of doing rate determinations for many services that have been hanging on, long overdue, determinations and rate studies, and that we get through that process and not have the funding is, hard to imagine. But I appreciate Director Probert raising it at this point, and that we would, have ongoing conversations about where we're headed, and then thinking about the MAC and going back to, the access rule and about our role to be able to advise. I don't think there's anybody who, not say, oh, we want to advise, we want to help find those dollars. Kathy, to your point about there's different ways to look at this. I really appreciate that, but it's just something that, certainly came out of that meeting and maybe a quiet summer Monday afternoon, for that you're not necessarily, hearing in the news at this juncture. So again, some sobering and difficult news to imagine that we'll want to keep on top of. We've also been talking about in this group about how to, as we're 2 years into the rate determination system and rate reform in the state of Maine, that has been, I think just really appreciated by everybody. And there's a lot of hard work. There have been hiccups along the way, but it is the case that this subcommittee wanted to take a look and say, oh, would there be any recommendations we'd want to make to the department or to lawmakers about any changes in the system? So that's work we're going to pick up this fall. We also want to keep engaging with MAC members, other stakeholders, and obviously the department about any recommendations that we may have, whether they're administrative or legislative, headed into the next session. One of the things that we didn't get to talk about, that, we may not have time today, Michelle, but is we know where we're headed with the removal of the service provider tax for many of the Maine Care rates, but we didn't get a chance to talk about it in the meeting. I know that the department was working to prepare a list of those, so folks could, I think most people know, but I also believe that there's probably one or two that people would be surprised to know, oh, I haven't paid, or I have been paying and I maybe shouldn't have, so because all of this came well before your time and has been a challenge to unravel. But having that list would be really helpful sooner than later for folks. So if you do have an update to share today, that's great. If you have one that you can be sharing at our next meeting, that would be welcome too. And before I close out, I will just share that our next meeting is at the end of September, and that's going to be the 23rd. At 2:00, and please reach out to me with questions or agenda items, and we will put on our agenda having a vice chair. It'd be really nice to have somebody helping out along the way. Thanks, everyone.
And Laura and Kathy, I can confirm that we will be able to discuss that code level list for service provider tax at the next MAC, and I recognize that taking longer than intended, so appreciate your patience.
Thanks.
Thank you. Also just flagging that Ian shared some additional information in the chat about their OFI 101 monthly webinars. And I will share that with the links following the meeting as well. And Laura, thanks for sharing the information about your upcoming meeting schedule. The last subcommittee update is from dental, and I'll do that, and I can keep it quick. I wanted to first thank the department because Courtney Pladsen is now attending our meetings to help with moving forward some of the concerns that folks have brought up within that space. We've had good participation of OMS folks in that subcommittee space all along, but it's helpful to have someone with a little higher level of authority to be able to figure out what is possible to make changes on. And then I also wanted to flag that the department is now doing a series of forums for providers, although others can attend as well, to try to address some of the things that keep coming up where there's either concerns that providers have shared around, for example, not knowing who the right person to contact is about provider enrollment challenges, or around errors with claims. But then also to be able to address other issues that continue to come up where it feels like some further outreach and education with providers is one way to make progress, and appreciate the department doing that as well. And they held their first forum last month, and it seemed pretty well attended to me. And I think part of our hope is that more providers attending those forums will also help spread the word to other providers about some of the places where there's been ongoing concerns or confusion that actually have been addressed, but maybe people aren't aware of. So that's an exciting development, I think, from the dental space as well. I don't know if anybody else from that committee would like to lift up anything else, but those were the two big things, I think. Okay. And then I'm just conscious of time. We also have our rules packet update. So let's move to that.
Yeah, thanks, Kathy. I can keep it very brief as well. Not a ton of updates since our last discussion, but just at a high level, our Section 20, Chapters 2 and 3, both home and community-based services for adults with other related conditions waivers, both Chapter 2 and 3 are in pre-review negotiations with the department and the Attorney General's office right now. We also have Section 31, which is our FQHC, Federally Qualified Health Center policy, that is also in pre-review, as well as our Section 92 Behavioral Health Homes policy in pre-review. Aside from that, we did adopt a couple rules in the last couple of months. Section 23 Developmental and Behavioral Clinic Services was adopted in early July. And I think a lot of folks are aware that our Section 25 dental policy did have an emergency rule that was adopted in late June. There was a subsequent proposed rule filed for Section 25 dental services to implement those changes related to reimbursement permanently. That rule was proposed pretty much immediately following the filing of the emergency rule. We did actually just have the public hearing yesterday. And as a reminder, the comments do close, the comment period closes on the 15th of this month. So please send your comments into us as soon as possible. And separate from that, just reiterating from last month as well, that our Section 43, which is our hospice policy, has also been proposed and is currently in the APA process. And that's it for me, unless folks have any questions.
Doesn't look like it. Thank you so much. And as we wrap up our meeting today, I did just want to flag, so we do have a scheduled meeting for September 3rd, which we can hold, which we can still have. A few people have reached out to me because it's right the day after Labor Day, and folks were concerned that a lot of people might miss it. I had been in touch earlier in the month. Lisa had from the department had reached out to say there's not really like a good way to move it to a different Tuesday in September from the department perspective. So I think our option would either be hold it and just know that some people might miss it, or to cancel. So I thought I'd put that out to the group to see if folks had strong feelings about one or the other. All right, well, not hearing any strong feelings, my instinct is to just go ahead and have the meeting, and know that we might lose some folks, given that it's right after the holiday. And still seeing no reactions, so let's go with that. And I, oh, sorry, I'm just trying to copy something from the chat to make sure I don't forget to send it. I'll share following this some updates from the links in the chat, and also reminders that we still need a vice chair. Either you could nominate yourself or someone else. Thanks, Michelle, for that suggestion. And then also that I'll note that Jillian's going to try to convene the provider subcommittee, but we still do need ideally a chair and vice chair for that group. We're working on getting a vice chair for the dental subcommittee. Laura, it might be good to try to think about a vice chair for the rates subcommittee too. And I know it can be hard. Happy to talk with folks if that's helpful. And appreciate, and I'll follow up as well about scheduling the strategic planning subcommittee group. Thank you all for everything, and I hope you have a wonderful rest of your day and rest of your month.
Thank you.
Kathy.